Hello, I'm Dr. Lonnie Herman, and in this video I'm going to share with you about a male patient in his early 30s who's been suffering dizziness, vertigo, and balance disorder for a few years, and he's been to many different types of functional medicine practitioners and neurologists and functional neurologists and hasn't gotten any results. He found me online on YouTube, like you may be. If you're finding me on Facebook or YouTube, I put all these videos up on YouTube. And there's something to understand about the human body, is that when it comes to vertigo disorder, you can have, or balance disorder, dizziness, or a lightheaded feeling. There's several different things that can cause it. If you go back and watch other dizziness videos that I've made, there can be infection in a blood vessel, there can be infection in a part of the brain, and so there can be infections and stresses and toxins in other tissues. And please go watch other videos that I put up here, because you're going to hear a common theme in all of these discussions, is that there are chronic infections and toxins that get into various tissues. We need to find them and rid them so we can stop the inflammatory malfunctions from the inflammation that you're experiencing. The inflammatory malfunctions, if that sounded good. So what I found in this gentleman, in his first tissue that needs help, is his capillary beds are not functioning as well as they should be. And what I found in those capillaries are mycoplasma bacteria, the Lyme Borrelia burgdorferi bacterial infection at a very high level in his capillary beds. I found multiple iatrogenic chemicals. I found multiple intracellular parasites. I found vaccine residues and side effects from these vaccines in the capillaries. And I found multiple food additive and food preservatives. That can come from toothpaste. That can come from frozen food. That can come from eating Chinese food or eating some crackers or cookies or chips or something throughout his life, and in certain drinks that are colored drinks, like like these fruit punches or these teas that have actually food coloring in them. So let's be aware of that. So again, I found a very high level of the Lyme Borrelia burgdorferi in this man's capillary beds. I found mycoplasma, iatrogenic chemicals, parasites, preservatives and additive food chemicals, and vaccines. The other main stress tissue in his body, there are some other parts that I did in this exam. I don't want to cover those right now in this discussion, but I want to share with you something else that I found in him, because this other tissue in the body, the liver, is the filter for the blood. And what would happen, let's just say your air filter in your house gets clogged. What happens to the way the air is going to flow through that air filter? Is it going to be normal or less than normal? Well, the answer is obviously less than normal. If you don't change your air filter for, let's say, 20 years, your air conditioning unit would probably have stopped working at that point, but up until the time where it stopped working, you're probably not going to have clean air in the home or your office or your car. You've got to change the air filter. Well, you can't change your liver, but you can cleanse it and get it to filter the blood better. So what would happen when the blood is going through a liver that is that's congested? That the heart's going to have to push harder. The blood is going to be strained through a liver. It's like having a strainer that you're putting spaghetti and water into. When you boil the spaghetti and pour that, dump it into a strainer, and some holes in that strainer are clogged. You're going to see that it's not going to strain through that strainer appropriately. The water is going to rise in there, and it's going to take some time to get that to strain, if it can even strain through there. So think of the liver that way. And the liver helps to balance hormones, and it does a number of things for us, detoxifying and so on. But when the liver is stressed, we can have stress in the bloodstream, and wherever the blood goes, the brain included, we're going to have stress. If we have less than normal oxygen levels in the blood because of the problem in the straining filtration system, less than normal oxygen levels in the blood, which can be tested with a perfusion index, simple tool. It's about $300-400 that we could put on a finger and or a toe, on the right hand, on the left hand. We can measure if there is peripheral blood supply that's normal with peripheral oxygen, oxygen supplying the peripheral blood flow to the peripheral tissues. So if the finger or the toe has less than normal peripheral oxygen supply, then what do you think is happening to the human brain? And when the cerebellum that controls the balance is getting less than normal oxygen, what do you think happens to its function? It's normal, it's better than normal, or less than normal? And the answer is, when the cerebellum or any other part of the brain is getting less than normal oxygen, it's less than normal function. So let's say that's happening to this man, because what I found here was quite startling. In his liver, He had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. He had 13 environmental stressors, invaders, aggravators in his liver, causing inflammation, systemic, causing less than normal flow of blood. Can that cause a balance disorder? And the answer is yes, it can be one of several reasons for a balance disorder. Not everybody has the crystals floating around in the ear that is going to make the balance disorder and do an Epley's maneuver and fix it. So in his liver, cytomegalovirus, also known as CMV. Cytomegalovirus in that liver that will make the liver less than normal function. Mycoplasma infection, just like what was in his capillary beds, mycoplasma in the liver. Herpes zoster virus, which causes shingles, may not have shingles on the skin, but it can be causing and is causing inflammation in the liver, and with or without the shingles expression on the skin. Coxsackie virus in his liver. Coxsackie virus is an aggravator, just like cytomegalovirus, just like the herpes virus. He also had ringworm. That's a fungus, ringworm in his liver. How did he get it? I don't know, but it's there and we got to get rid of it. And he had three different types of parasitic infections in the liver. That can come from eating some cooked meats years ago, even if he's a vegetarian now, which I don't think he was a vegetarian now, but I just want to bring up a point for people who are vegetarian watching this video. You could have eaten meat when you were a kid, or you were born from a mother who was a meat eater at some time in her life, and maybe she got parasites that way, and it just went through the bloodline of the umbilical cord into your body, and it's sitting in tissues, and they're growing and laying eggs and growing and feeding on you and stressing your liver, which stresses your body. I found with him multiple metals like lead and cadmium and arsenic, and so there's others that I found in his body. But I also found two different kinds of mercury, a dimethyl mercury and a methyl mercury in his liver. Whether that came from his teeth, from a filling, or whether that came from eating seafood, or whether that came from maybe it was in his parents who had fillings and it got through the bloodstream into him, or maybe it came from a vaccination. Those are all possibilities, but where it came from, sometimes at this point in a man's life, it doesn't matter. What really matters is to get him the results that he wants his life to get better, and that's what I'm here to help deliver for him and to him and with him. I see him again in a month, but a major stress for him was all stressors or all these infections in the capillaries in the liver. I'd like to say that I know that he's going to have improvement after the first round of treatment, but I just don't know. I don't have a crystal ball. People ask me all the time, am I going to get better in this first treatment? Maybe yes, maybe no, but you're going to get better in your body's ability to function, but maybe the dizziness for him won't go away yet. Okay? But it will go away in time as we clear away the stressors causing the balance problem. Okay? Thank you for listening to this video. Watch my other videos. Share this video with a friend. Click the subscribe button on my YouTube channel. I always share new information in there. It all starts to sound about the same for some people. For me, because it is too, because I'm seeing all these infections in multiple tissues all the time with my practice in my clinic, where I'm all about these chronic diseases, and again, it's all about getting you the results. So we've got to get down to the root, the causes of your illness. Call my office, 954-370-3100, and I look forward to sharing more information with you and helping you get well too. Thank you.